The need to review the current medical education to enable an improved medical platform to counter epidemics like COVID-19. Since the Flexner report of 1910, many of the changes in the 20th century could be viewed as post-Flexnerian and post-Oslerian, which highlighted the importance of biological elements and the importance of bedside clinical experience in the medical curriculum. However, the recent changes in healthcare systems and the enormous challenges posed by medical inadequacies to cope with massive pandemic like COVID-19, with an unexpectedly unimaginable death toll worldwide, or the possibilities of other biowarfare or future pandemic will demand for very serious and a critical re-examination of our approach to the current medical education. To be more prepared for the future medical challenges and extremities, one approach is to highlight a mandatory requirement of ethics in the medical curriculum and a strong regulatory requirement in confining the handling of all deadly pathogenic materials stored or studied in the Phase 3 facilities, which may cause infectious diseases. There should also be inclusion of strong practical lessons on crisis management and disseminating infectious diseases prevention methods to existing medical frontliners and medical personnel. We should also aim to decouple clinical education from clinical care to some degree and supplement it with a medical curriculum designed around careful sequencing of simulated cases rather than hours of classroom lectures. Abraham Flexner and William Osler names are quite relevant when it comes to medical education in the 20th century in the North American perspective. Flexner, who lived from 1886 to 1959, is an American educator who was commissioned by the Carnegie Foundation to review American medical education. His recommendations had the effect of closing down many freestanding medical schools and incorporating medical schools within existing universities, where students may completely acquire the skills of academic inquiry and the language of biological sciences to ensure that medicine was firmly rooted in biological science. It is justifiable that he wanted emphasis on detailed analysis of the physiological processes at cellular levels contributing towards the synergistic functions of different organs. We shall hope for concerted efforts from all the medical institutions worldwide to make their efforts towards inclusion of new and relevant syllabus into the current medical education. Osler, who lived from 1849 to 1919, was a Canadian physician. Born in Bond Head, Ontario, he grew up in the suburb of Hamilton. He took up academic positions at McGill, Johns Hopkins, Pennsylvania, and Oxford. It is Osler's brainchild to focus on the importance of residency and clinical command as a significant part of medical education. These two renowned medical educators mentioned would have been devastated to see millions of deaths and thousands of COVID-19 orphans where many children have lost both their parents due to COVID-19. The severity of COVID-19 implication on global economy, loss of lives, need of new social platform for counseling the children who have lost their parents, made the awareness urgent to review and include several new aspects into the existing medical education. Perhaps the global population safety and usual economic activities are restored after many businesses were irreversibly ceased due to COVID-19.